Chuck Todd.
Thank you, Mr. President. And Merry Christmas and Happy New Year. You've talked about the issues with healthcare and the website rollout, but there have been other issues, the misinformation about people keeping their policies, the extended deadlines, some postponements. We have a new waiver that HHS announced last night. How do you expect Americans to have confidence and certainty in this law if you keep changing it? This one here, this new waiver last night, you could argue you might as well have just delayed the mandate.
Well, no, that's not true, because what we're talking about is a very specific population that receive cancellation notices from insurance companies. The majority of them are either keeping their old plan because the grandfather clause has been extended further, or they're finding a better deal in the marketplace with better insurance for cheaper costs. But there may still be a subset, a significantly smaller subset than some of the numbers that have been advertised, that are still looking for options, are still concerned about what they're going to be doing next year. And we just wanted to make sure that the hardship provision that was already existing in the law would also potentially apply to somebody who had problems during this transition period. So that's the specifics of this latest change. You're making a broader point that that I think is fair, and that is that in a big project like this, that what we are constantly doing is looking, is this working the way it's supposed to? And if there are adjustments that can be made to smooth out the transition, we should make them. But they don't go to the core of the law. First of all, the core of the law is that for 85% of the population, all they've been getting is free preventive care, better consumer protections, the ability to keep their kids on their insurance plan until they're 26, $1,000 or $500 discounts on prescription drugs for seniors on Medicare. So 85% of the population, whether they know it or not over the last 3 years, have benefited from a whole set of the provisions of the law. And by the way, if it were to be repealed, you would be taking away all those benefits from folks who already are enjoying them. You had this sub portion of the population, 15%, who either don't have health insurance or are buying it on the individual market. And that's still millions of people. And what we're doing is creating a marketplace where they can buy insurance and we can provide them some tax credits to help them afford it. The basic structure of that law is working, despite all the problems. Despite the website problems, despite the messaging problems, despite all that, it's working. And again, you don't have to take my word for it. We got a couple million people who are going to have health insurance just in the first 3 months, despite the fact that probably the first month and a half was lost because of problems with the website, and about as bad a bunch of publicity as you could imagine. And yet, you still got 2 million people who signed up, or more. And so what that means then is that the demand is there, and as I said before, the product is good. Now, in putting something like this together, there are going to be all kinds of problems that crop up, some of which may have been unanticipated, and what we've been trying to do is just respond to them in a common sense way. And we're going to continue to try to do that. But that doesn't negate the fact that, a year from now or 2 years from now, when we look back, we're going to be able to say that even more people have health insurance who didn't have it before. And that's not a bad thing. That's a good thing. That is part of the reason why I pushed so hard to get this law done in the first place. And, I've said before, this is a messy process. And I think sometimes when I say that, people say, well, A, yeah, it's real messy, and B, isn't the fact that it's been so messy some indication that there are more fundamental problems with the law? And I guess what I'd say to that, Chuck, is when you try to do something this big, affecting this many people, It's going to be hard. And every instance, whether it's Social Security, Medicare, the prescription drug plan under President Bush, there hasn't been an instance where you tried to really have an impact on the American people's lives and well-being, particularly in the healthcare arena, where you don't end up having some of these challenges. The question is going to be, ultimately, do we make good decisions trying to help as many as people as possible in as efficient a way as possible? And I think that's what we're doing.
But with 72 hours to go, you make this change where people are buying the junk, frankly, a junk type policy that you were trying to get people away from.
Well, keep in mind, Chuck, first of all, that the majority of folks are going to have different options. This is essentially a additional net in case folks might have slipped through the cracks. We don't have precision on those numbers, but we expect it's going to be a relatively small number because these are folks who want insurance, and the vast majority of them have good options. And in a state like North Carolina, for example, the overwhelming majority of them have just kept their own plans, the ones that they had previously. But we thought and continue to think that it makes sense that as we are transitioning to a system in which insurance standards are higher, people don't have unpleasant surprises because they thought they had insurance until they hit a limit, and next thing you know, they still owe $100,000 or $200,000 or $300,000 for a hospital visit. That as we transition to higher standards, better insurance, that we also address folks who get caught in that transition and their unintended consequences. And I'll be honest, that was the original intent of the grandfather clause that was in the law. Obviously, the problem was it didn't catch enough people. And we learned from that, and we're trying not to repeat those mistakes.
The mandate to be enforced.
Absolutely. Yeah. Let's see.